we have to think about more parts of our body than just the physical part. We want to talk about our eyes this morning because eye care is super important. Dr. Sandy Feldman with the Clearview Eye and Laser Medical Center is in today with ways to keep your eyes looking good in the new year. Good morning.
Good morning.
You know, is this something that people overlook when you think about your health?
Yeah, we forget about it, but it's really important to have an eye exam because eye exams help save your lives. You know, the eye is really a window to the health of our body, and it's one of the few places where we can actually see blood vessels. You may not know you have a disease, but when I look in the back of your eye, I can see that you do.
Really? Like what kind of disease?
Like dangerously high blood pressure or uncontrolled diabetes.
Really? All in an eye exam you can tell that?
Yep.
Wow. Okay. And so then obviously you'd be referred to another doctor. But besides that, you could tell us that our eyes aren't in good shape and we need to do something about it, right?
Exactly. And the important thing is that often we can do something about maintaining our health. And so we want to take control and actually start to do that. And the first little step is making sure that you see an eye doctor.
Okay. And you brought in the eye exam chart, and it's funny, everyone's testing out their vision. Do you find that people haven't had one in years and they come in and try to do the eye chart and they can't see a thing?
And they're really surprised by that. In addition to saving lives, the other advantage of an eye exam is it can actually make you look young. You say why? Because most of us forget that if we're wearing glasses that aren't proper for us, that we may squint, and that may increase the little lines around our eyes. So we all want to see the eye doctor and keep ourselves looking young.
I gotcha. Okay, get rid of those wrinkles. You also say it's helpful for preventing accidents.
That's right. You know, diseases like glaucoma will impair your sight, and obviously if you're driving, that will affect you and you can have more accidents.
Okay, tell us about some of the things you brought here today and things we can buy to help out our eyes.
Well, let's say you have redness of your eyes. Redness can occur because there's small little blood vessels that cover the white part of our eye that get irritated. What we don't want to buy are the drops over the counter that say, get the red out. We don't want to use those all the time. If we do, what they do is constrict the little blood vessels, and then when they wear off, your eyes get redder.
Oh, okay. So that's not a good option, what we're looking at. What is a good option to use?
Well, that's where seeing your eye doctor, you want to understand why your eyes are red and get eye drops or treatment that treats the underlying cause.
I mean, there is a way to help out with chronic dry eye, like Restasis, some of those sorts of medications?
Exactly. So a Restasis is a prescribed medication. There are lots of over-the-counter medications as well, including teardrops. You want to watch the preservatives in the teardrops because those can cause more irritation. One of the things you probably haven't heard too much about is a recent study shows that drinking caffeine or having caffeine actually helps you produce more tears.
So drink up your coffee.
That's a
great.
good excuse.
Okay, and then before we let you go, you wanted to remind us to protect our eyes with goggles and sunglasses, even in the winter.
That's right. You know, the invisible ultraviolet light rays can pass through clouds and even in the winter can harm our eyes. So we want to wear sunglasses or goggles. And we have to remember at altitude, if we're skiing or snowboarding, that we get double the exposure of ultraviolet light and it gets reflected off of the snow.
Yeah, it's tough. I mean, it's even tough to look at, so you got to protect your eyes for sure.
That's
Doctor, thank you so much for coming in. Okay, eye exams for everybody in the studio this morning, yeah? Okay, we'll have them come see you, Doctor. Thank you.